My name is Simon Mukena in a Rotoveni clinic where I'm attached to, but based in the community. Coming from Zambezi, working for DAPP TCE in the Otjozondjupa region. I'm a community-based field officer targeting the community itself. It can be the families and groups of all the community adherence clubs. My specialty is a TC field officer. We do HIV testing counseling in the community. We do adherence counseling for those who are on medication. We do malaria, also referral to the facility. We're doing COVID-19 also testing. And also now nutrition program also came in, so that we are targeting the malnourished children, breastfeeding, and also the families together, and begging them to have their backyard gardens in educational sector, and for them also to improve their healthy eating variety of foods. The training, it was held in Otjozondjupa. That was in November 2024. My memorable moments that I engaged in the training, it was the empowering and experience of nutrition program, enhancing the in embracing the Namibian food security. Remembering that in our community we have a lot of malnourished children, and the people who are having food but not ideally eating excess with the way they are supposed to be. So I really remember that, and I really have the capacity building of that. So it was very fun in the training. After the training, it was like an eye-opener to me, because ideally things that I used to do earlier on is not the two things that I do, because currently now I'm mindful when it comes for eating habits. Like that time I just would go in the shop, pick anything without knowing the sugar the content of the product. But now currently I've practiced to eating healthily, reduce the sugar and salt eating. Whenever I go in the shop, for now I need to check what is the content of the sugar level on the product or any food type that I'm going to. So, and also now selectively looking at the food type that I need to eat. That is mainly promoting my healthy capacity of living. Since I'm a field officer based in the community, after the engagement of the training, enhancing into that, so I practiced after the information shared with me, then I already that transforming the information into me myself before I taking it to the community. So through that life that I started with, I took that life, the same experience that I went through, to take to the community. So I started applying, because since we work in the community closely with our clients, engaging them in different health sectors. So when nutrition came in, it's a process that really which was shot into the umbrella to be part of it, so that at least they eat health eating, practicing, and having the gardens being done in the community to help for those who cannot afford to have everything on the plate. So more especially, that's how I started to come up with it. Then when it came into me, then I thought, then this is a very good information, or at least let's share the right information by using the material that were provided by the Northern team. So during using the pamphlet on giving health education at the facility, even in the community, you give the pamphlet for them, they can read for themselves. So after they do not understand, when you come back to come up with another thing, then they'll ask where they did not understand. So that's how I practically took from the training to the community. After you bring something, the next time when you come, the person will tell you, no, I tried what you brought to me, and I saw that it's working. Even them now currently, as they are preparing for the food, they know what to do, what not to. Sometimes, for the example of food type, and also now teaching their kids on how they must eat and what they have. Preparation methods is underway, because that's one also the problem. Sometimes I'm too with the time I don't check the measures. The pot is not clean hygienically. Now people are also trying to, most people will be asking a few questions, especially on healthy diets, because they want to follow in, because they've seen that it's a thing that has helped them in helping their children fully on a capacity to understand such kind of nutrition program in healthy habits living. It's a very good training that we have, and it was a very good supportive training that we needed by the community. I wish and hope that such kind of programs can continue to enhance our Namibians, because it's not everybody who has the money, who has skills and understanding, knowledge to come to simpler terms, especially the community. I wish all the organizations which are based in the community could go through these trainings in order to improve the living standards, the eating habits, and also improve our new generation which is coming, because agriculture sector, it needs to take in more information and also to help the community to understand, because without eating healthy, then a lot of deficiencies which will look like diseases, and a lot of things can happen. So in just only eating healthy, it promotes the lives of our community, even us within together, because all together we make the change for their lifetime.